Hi, everyone. Welcome back to Annual Conference Live from 0 to 3. I'm Will Halicks. Here today for the first fireside chat, which we're going to be holding every day from now until Friday with some of our leaders in the field. This is our first session, which is going to be on how to support babies affected by the opioid crisis. And I'm pleased to be joined by Dr. Kalpana Miriyala. She's an assistant professor of child and adolescent psychiatry at Marshall University School of Medicine, and Dr. Joy Browne, who's a clinical professor at the University of Colorado School of Medicine. And Fielding Graduate University. So thank you very much for being with us.
Thank you.
Thank you.
So we hear a lot about the opioids crisis in the media with good reason, but very often infants and toddlers are left out of those stories. Can you tell us how opioids and substance use disorders affect infants and toddlers?
Yeah, these children who come into the world when they're born, having been exposed to substances, many times land up in the hospital and often in an intensive care unit. Necessarily so because they have some disorganization in a number of areas, and this disorganization makes it really critical that they get the kind of treatment that they need, both from pharmacologic perspectives as well as behavioral perspectives. So these babies are affected early on with difficulties with their physiologic regulation, with their motor control, with eating, and with the ability to be soothed and interact with their caregiver. So the main difficulty during that time is helping them with managing coming off of the medication that they were exposed to, and also to establish the relationship with the parents that in this sensitive period of time when the baby is developing, the parents are new parents, there's a wonderful opportunity to interact, to support both the baby and the parent. Long term, these babies are being shown to have difficulties as well, both in their behavior, in their thinking, in their sensory capacities, and those kinds of things. But the relationship that we try to support during that period of time to help the parents with knowing how to soothe their babies, how to support the babies with regulation is really key.
And I'd also like to add that in addition to the immediate impact, as Dr. Browne mentioned with the abstinence, going home into a household where substance use is prevalent exposes the child to multiple stressors, adverse childhood experiences that make it, that increase their risk for long-term psychiatric and health problems, even things like obesity, high blood pressure, diabetes, not just psychiatric illnesses, and also predispose them to substance use as well. So, substance use in the household can be pretty stressful for the baby, especially in the early years. And so those are impacts that can last a lifetime.
Absolutely. And so for these, what sounds like really truly comprehensive challenges from this, what are some resources that you would recommend to professionals who support families and infants and toddlers who are impacted by this? SAMHSA, which is the Substance Abuse and Mental Health Administration, they have a couple of guides out there. One is a clinical guide for treating pregnant and postpartum women with opioid use disorders. And then the other one is a collaborative approach to treating pregnant and postpartum women that talks about how to build collaborations between different systems dealing with these women. And they're both free and available to download for free on their website. Another website is the National Center for Substance Abuse and Child Welfare. They have a lot of resources online and training webinars that are free for use. That's great. Thanks so much. Was there anything to add?
I think that thinking about the developmental needs of these infants is really important in terms of not only treating the mother, not only treating the baby, and to help them with the regulatory capacities that they have during this really sensitive period, and having people really understand how to help the mother identify the communication of the baby, to understand how to soothe the baby, and as they transition into the community, to really link them into good resources like early intervention, like other community mental health centers that can help primarily with the relationship.
Absolutely. Well, thank you both so much for joining us.
Thank you.
And thanks to everyone in the audience for joining us as well. We're going to be coming back at 5:30 with our next fireside chat with both of our opening plenary speakers, so we hope you'll join us for that. In the meantime, you can learn more about these issues and resources to help at 0to3.org/AC Live, and we hope we'll see you for the next session.